we feel, just some numbers to throw out there, for every dollar we spend in terms of getting a patient adherent, we save on an average $9 on the medical side in terms of hospital, ER room visits, physician visits, labs, etc.
Could you incorporate this into what you offer your clients as a value-added service?
We probably could.
Mm-hmm.
The younger folks, as you talk about with the ADHD, that's a natural because they're probably pretty knowledgeable about cell phones, the application. If you have, for example, an Alzheimer patient, and my mother's got Alzheimer's and she's in Chicago, I'm in San Francisco, I use a tool like this to make sure she takes her medication.
Mm-hmm.
I mean, that would be tremendous in terms of compliance. If you're not compliant with Alzheimer's, the disease, dementia, continues to progress.
Right.
You may even be able to use this as like a value-added program for a particular drug,
Mm-hmm.
To increase the compliance and give them a $10 coupon or whatever.
Right. No.
That's another avenue that
Right.
you would have.
What's your overall net impression? Are we smoking dope? Do we have something of value?
I think there's value to that. These events, when the person takes their medication, they press the button, and you're good to go.
Mm-hmm.
That's as good as it's going to get in terms of tracking, and then you can compile the data and you can bring it to your doctor's office. I think that's great. It's using technology to increase people's compliance and persistency.
Would you be open if, let's say, a year from now, my prototype is functional? Can we come talk to you about doing a pilot with you?
I'm probably not the decision maker on that,
Mm-hmm.
but I think our higher level folks might be amenable to that.
Mm-hmm. Mm-hmm.
We're trying to look at ways where we increase adherence, closing gaps in care, like a diabetic needing to take something for hypertension, also for their high lipids, high cholesterol, in addition to taking their medication for their diabetes. So we're all about making sure that we're getting people healthy and keeping them healthy.
Mm-hmm.
This could be a great adjunct to that.
Mm-hmm.
And when I think of the capabilities of that smartphone, that's endless.
Okay. How many lives do you guys cover?
Over 35 million.
Oof.
We're one of the big two. So
Uh-huh.
you've got United and you've got WellPoint Anthem. Now on the government Medicare side, we're a player in Medicare. We have to do adherence compliance. It's called MTM.
Right.
And we have to do that, medication therapy management. We have to show that we provide so much that is actually towards the patient coverage and so little amount of admin. So it's a new requirement that we have to put 85% of what we do has to be in the coverage and support of our members for outcomes and health. So a device like this, I totally see it, because what we're doing now is
That would fit in the 85 or the 15?
no, in the 85.
Uh-huh.
So here's what's happening. Companies in the past could spend 40% of their money on taking care of their patients and 60% on admin or profit or whatever.
Mm-hmm, mm-hmm.
Now those days are gone unless
Mhm.
this bill is thrown out.
Mm-hmm.
So what have health plans been doing? The Uniteds, the Aetnas, the Cignas, the WellPoint Anthems. We all of a sudden had to start doing things to provide care. We started giving away eyeglasses. We started giving away extra diabetes supplies. We started giving away testing because we got to get that we got to get things down to that 15%.
Huh.
This.
So you could give this away.
We could give this away.
Yes, please. Sign you up.
The second way is mail order.
Mm-hmm.
Then you get the PBMs involved.
And
So the device.
there's more time there.
Yeah, and they ship it. They ship it out. So you'd have to figure out the pricing for shipping your device.
Mm-hmm. But it
mail
would ship
order,
preloaded with
preloaded for if your device was fit in with mail order 90-day supply,
Mhm.
which is what mail order uses,
mhm.
that is a win-win.
Just like, would this device increase compliance? Yes, it would. It would, no doubt about it.
Mm-hmm.
Maybe the way you sell to health plans is saying, look, you got all these drugs, they're going to be $50,000 per course of treatment. Start with Incivic, because everybody uses Incivic.
That's the
It's-
Vertex drugs.
Yeah. $4,000 a week.
Mm-hmm.
That's, $500 a day $80 a capsule. Say, if you give this to the patient, then the patient's you're going to make sure the patient's compliant. So you know who probably paid for the machine, give you a bunch of money?
Vertex.
Vertex, sure.
Yeah.
I mean, if somebody came back to me and said, we have this device available, and I had a patient on this expensive drugs, I would want to mandate this device. And they only benefit. They only benefit from being in this little machine. I mean, I think you might have something here. I really do.
Mm-hmm.
The more I think about this high-cost drug thing, and it would be very easy for me to go to my people and say, for these uber expensive drugs, we're going to use this device that mandates the patients to become compliant.
I think that there's probably a portion of the population that could benefit from that. I would think it would be a patient that's got a lot of medication, that kind of thing. I think if you have a complicated patient and they're having a problem remembering or coordinating, then I think, you know, that sounds really kind of interesting. But I could see pharma supporting it, you know, with a particular therapy and, you know, working with a particular pharmacy or group of pharmacies or something like that. I could see that.
Like a
But-
specialty pharmacy for some of these
Perfect. That would be
expensive
perfect.
drugs.
Yep.
Yeah.
Or even say a transplant patient, right? Where they
Transplant patients, yes.
Or HIV.
Could you see a PBM marketing this as a value-added service to their customers?
I could. I think that there would need to be pretty good clarity as to who the candidates are, how they identify them, how they get it set up, and then on the back end reporting it.
Do you think this is a strictly business-to-business idea, or could we put this on a shelf at a Walgreens for walk-in customers just to buy it themselves?
I think that's a possibility.
Well, good for you for coming up with this innovation. No, you've done your homework.